Hi everyone. First of all, thank you very much to SDF for inviting us to come and present with you today. So my name is Claire Longmuir. I am the Head of Policy and Practice for Harm Reduction for Simon Community Scotland. Simon Community Scotland, for those of you who don't know us, we're the largest provider of homelessness services in Scotland, and we do a variety of different things within across Edinburgh, Perth, North Lanarkshire and Glasgow. But what I'm going to speak to you about today is about our policy shift from a zero tolerant approach to substance use within our residential services into a high tolerant approach within our residential services, which has now been framed as our safer services model. So why for us is harm reduction within homelessness so important? So within our services we deliver a lot of various different things now, but really that wouldn't have been possible 3 years ago when we were still had a zero tolerant model to substance use. And what that looked like for us, if you asked any of our staff within our residential services at that time, they would have said, we deliver high tolerant services. We work with lots of people that use drugs. There's drug use that goes on in this building. We already deliver high tolerant services. But what the policy said was, while we won't exclude you for drug use on one hand, don't bring your drugs and alcohol into this building. And if you bring your drugs and alcohol into this building, you'll be asked for those drugs to be removed from this building, and we might actually confiscate those drugs from you if we deem them to be too high risk. So actually, while that might have felt like a high tolerant model, it was very much a zero tolerant model to substance use within our residential services. Now, harm reduction for us is not just about safer injecting equipment or the provision of naloxone or making sure that people have got access to wound care. It's very much founded on the principles of social justice and human rights, and ensuring that people have choice and agency, importantly agency, to use that choice in a way that makes sense for them in relation to their treatment and care and their support. You know, if you're working for us, we work with people who experience prolonged and reoccurring periods of homelessness, and it's often not possible or sometimes desirable to stop using substances when people are engaging with their services, and asking people to abstain from drug use when they're moving into sometimes supported accommodation or emergency accommodation is just not realistic. Another reason why harm reduction is so important for us is that it ultimately saves lives. Since we started delivering what we now call our safer services model, when we first put this into place in 2020, we'd already lost 17 people to drug-related deaths, preventable and avoidable drug-related deaths. In the 12 months after implementing this policy, we had one person die from a drug-related death, and we've sustained that over the last 3 years. And for people experiencing homelessness, we know from the statistics that over 51% of people who experience homelessness die from a drug-related death. So this is very much something that we felt as an organisation we needed to address and we needed to step into. It's about building trust. We've heard already today that people do find it really, really difficult to trust services because very often people have been in services for decades, and not only have they experienced trauma in their lives, but they've experienced system trauma, where they've been told that they're going to get a certain treatment or certain support and that's not happening for them. So it's recognising that structural violence and discrimination and not expecting people to fit into our policies, actually creating policies that genuinely meet people where they are. And the most important part of it all for us is about that connection and that community and that opportunity for healing. So we always talk about the journey, don't we? So our journey so far. So I joined the organisation in 2020, and that was the year that we had seen that peak of 17 people lose their lives to drug-related deaths. Now, that had been increasing year on year for the last 5 years for us as an organisation. And in 2018, we started including wide provision of naloxone across our services, CPR. We also trialled radar technology within some of our North Lanarkshire services to address drug-related deaths. But in 2020, the organisation invested in a harm reduction resource. We started introducing widespread workforce training. Now, when I was putting this graph together, it looks like it's a linear process, but it never is, right? It never is. And we had lots of learning and backwards and forwards along the way, but we started to introduce workforce training where it was like, why is harm reduction important to us within homelessness? It's about reducing drug-related deaths, it's about giving people choice, it's about ensuring that people have access to what they need when they need it, but also it's recognising that people have experienced a lot of trauma and people are using drugs for very, very reasonable reasons. And it's about ensuring that we have the tools, the skills and the confidence to open up conversations that might have otherwise otherwise been closed to us. And that was the reality when we delivered zero tolerance policy, and services. Those conversations were closed because people felt that they couldn't talk about their drug use. They weren't able to come down to staff and speak about what was going on because of his fear of that consequence. We established a national harm reduction champions network, which is still ongoing. So we have harm reduction champions in all of our services across the organisation. And that's really to allow us at a national level to really respond to what's going on locally, because it is different in Edinburgh than it is to Glasgow, than it is to North Lanarkshire, not just in terms of what's going on for people who are trying to access support, but in terms of the partnerships and all the various different things that go on in that locality. And then in 2021, we launched our enhanced harm reduction policy. Now that came from us looking at the national and international evidence. We're not the only homelessness organisation to deliver this. Actually, we're a little bit late to the party. There's organisations across the UK that have been delivering this model. We have been working alongside other organisations across the UK that have been delivering this for decades. So places in Northern Ireland, places in Wales, places down in south of England. And we based it on the original work of Kevin Fleming, who's done a lot of work in this area in relation to high tolerant models in terms of how do you work within the Misuse of Drugs Act, how do you ensure that you're working within those parameters and creating a safe space for people. And what the introduction of that policy did was it created this space for harm reduction. It created this space to build those connections, to offer people opportunities to access safe injecting equipment that we deliver now in all of our residential services in Glasgow. We now have WAND practitioners, which comes a little bit later, that can deliver the full harm reduction intervention, so wound care, assessment of ejecting risk, naloxone and dried blood spot testing. And a big part of this for us has been about continued learning and progression. So we established a series of best practice guides that we put out to all of our staff every single month. And that really embodies what it is that we're trying to do, why we're doing it, but also uses, for example, trauma-informed language. It embodies our values. It really pushes what we want to see within the services through the best practice guides. And like I say, we have got now our residential staff, a number of our residential staff trained to deliver WAND in-house. We've delivered over 45 full WANDs within our residential services, and particularly for women, we have gender services, so 4 women's only services in Glasgow, 1 in North Lanarkshire and male only services, but particularly for women, where